Somebody asked about a day ago if I could talk about the boundaries that actually take place during the therapy. And I thought it was such a good question because I don't think this gets talked about a lot. So, hi, I'm Danna. I'm a psychotherapist in Philadelphia, and I think about therapy and all of its intricacies all the time. So, in terms of the boundaries in therapy, we're sort of blindly assigned them, right? Like you kind of have this information from the outside world as a client, like you're not supposed to ask your therapist too much about themselves. And the therapist gets this kind of information from school and a bunch of other places like supervision, like you're not supposed to talk about yourself. So one set of boundaries is just around therapist self-disclosure. And I think it's really, really helpful for the therapist to help the client know what can and cannot be asked of them. Like, do you need to know about my social location? Would it be helpful to understand my process? Would it be helpful to know more about my training, any of my personal experiences? And it's really like helpful in terms of setting the boundary in therapy for the therapist to invite the client in to share their curiosity, or else the curiosity is like kind of torturous to the client. So one boundary that I feel like is worth normalizing is like, you get to ask me things. And also in that, you need to trust that if I feel like I can't answer for some reason, that like I won't, and I'll tell you, and I'll be really explicit about, you know, what feels important to me and what I'm going to keep private. Another boundary in therapy for me that feels like of the utmost importance is the frame itself. I like having sessions at the same time on the same day every week, and I start on time and I end on time. And I'm watching the clock the whole time, and I'm holding the boundary partly for my client around like how to manage their own affect. I'm not going to ask a really intense question with like 5 minutes left. I'm going to be like, so how am I going to help this client to feel contained? One of the important therapy boundaries we need to set is around containment and not dismantling our clients so that they can't sort of go on throughout their day or their week or their life. So we have to be kind of responsible for how we're holding the fragility of the process. I end on time because I've never really seen the benefits of going over. The predictability to me of the frame is what allows so much unpredictability, and spontaneity to take place in the relationship. So if I know that the session is going to last this long and it's going to end at this time, I feel like all of this flexibility and freedom within the treatment relationship itself. Another boundary that I think about in therapy is before I ask my clients things, most things actually, I ask for consent. Like, would it be okay if I asked you about? And how would I know if I was like getting involved or asking you something that just feels like somewhat out of bounds or not like what you can handle today? So I do a lot of normalizing of like, you might not want to talk about this, or these questions might be like too much for you, and you have control over the content of this session. I think the most important boundary though, like of all of the boundaries, is that the session has to happen in the service of the client. It has to exist not for the narcissistic needs of the therapist to feel like they've accomplished something or they've achieved great symptom management, or I don't know, that, you know, your client has some like really idealized feelings towards you. The therapy needs to exist in the service of the client. And most things that I say, I think to myself, who am I saying this for? And the answer is not always clear. It's not always binary. And if I don't always know the answer, I try to sit with that for a minute. Like, actually, I think this is for you. And I have to give myself, honestly, like a few questions throughout the session that I know I should need answered for my own curiosity as the therapist. But for the most part, I'm thinking through the lens of something called a fiduciary relationship, which is that the relationship is one that is built to benefit the client and never exploit them. And so the boundaries that I'm most interested in is, how can I be regulating myself and taking care of myself as a therapist outside of this room in such a way that I can be showing up for this client in the most intense and professional, I don't love that word, I don't even know what I mean by it, but intentional feels like a better word, how can I be showing up for this client in the most intentional and least exploitive way possible? And when I'm talking, how can I be soothing myself enough that I'm not looking to the client for feedback on how I'm doing, and they're not having to take care of me? And they know that the space that they're in when they're in therapy with me is space for them to be taken care of during, that the space is for them. And so many of our clients are caretakers, and I feel like the most important boundary we can set is to say, like, when you're in here, I'm here to take care of you, not the other way around. Or else they can just sort of fall into the role of caretaker super easily, and like that's an enactment you don't really want to get into and is not particularly healing. So for our clients, I feel like what I'm most interested in is them really knowing that that time and that space is for them, and that's what I'm here for. And I'm like thrilled to do it, and thrilled to like be able to be part of the process of somebody unlearning caretaking that like hasn't served them well in their life.